one of the issues with a lot of positive pressure therapies like CPAP or ventilation or whatever is that pressure and comfort. Patients don't want to feel that on their face. So high flow already, as long as it's high humidity, high flow, is typically quite comfortable, especially in the home care space when we're talking about more moderate flow rates. But then you add on a cannula that makes the flow feel even a little bit more natural and is quieter. Absolutely, I think that's going to have a huge impact on adherence moving forward.
Since we met last time, there was some misconception, I would say, in the market. So I know humidified high flow is often confused with oxygen, and that's what was coming out of that. But
Yep.
this isn't just about delivering O2, though, correct?
Yeah, no. In the acute care space, high flow is often talked about with really high oxygen levels, and those kind of go hand in hand, right? COPD patient goes into the hospital with an acute exacerbation, they're throwing on 60 liters of airflow and 100% O2, right? In the home care setting, that's not really the patient we talk about. When I'm talking about humidified high flow, I'm talking about humidified, warm, moist air, and airflow, room airflow. Oxygen is just an added bonus. If a patient has oxygen needs, which admittedly a lot of COPD patients do, right? If you look at a lot of the clinical research, there's one in 2018 I talk about all the time. All of those COPD patients were on about 2 liters of oxygen with high flow. So occasionally oxygen can be added on, but that's not really the main benefits that you get out of the therapy. It's more that optimal humidification and the flow, the respiratory support that helps with like dyspnea, shortness of breath, things like that.